Welcome to this first session of the Congress. Genetic counseling is an emerging profession in many areas of the world, and the profession is still developing in many regions. In this session, we will hear from different areas in the world about the development, the certification process, and legislation system for genetic counselors in different areas of the world. Julian Lee from Malaysia will talk about the development of genetic counselors in Asia. After that, we will hear Milena Panek, who will talk about the development of the certification process for genetic counselors in Europe. Man Savati from Canada will then talk about the legal recognition road for genetic counselors in Canada. Finally, in this session, Jan Hodgson will talk about how we can educate genetic counselors in a safe way in a virtual world of COVID. He's from Australia. And after the talks in this session, there will be a number of lightning talks before we will have a question and answer session. Thank you.
Very good morning, everyone. Firstly, I'd like to thank the organizers for inviting me to speak in this conference. My title is Professional Development of Genetic Counselors in Asia. So let's start with the definition of genetic counseling. So genetic counseling is defined as a process to help people understand and adapt to not just the medical, but also the psychological and familial implications of a genetic disease. So a genetic counseling session comprises of interpretation process to assess the family history of the patient and also to determine the chance of a disease to occur or recur. Secondly is genetic education to educate the client about inheritance mode, genetic testing options, clinical management, what the prevention methods for the specific condition, and to update on the resources and research available. That component is actually the counseling process to help support the client after a genetic diagnosis has been made, or to promote informed choices in determining which genetic testing should be performed or whether it should be performed, and also to help the individual and family adapt to the genetic risk or the condition. So who are genetic counselors? So we are basically healthcare professionals who are specialized in medical genetics and also counseling skills. Most of us traditionally work in a clinical setting in a university-affiliated hospital, together with clinical geneticists to see patients and families. So as the years went by, we have more job opportunities as well in our region, whereby some of us are working independently, also with diagnostic laboratories, research centers, participate in training programs, get involved in policy development in public health departments, provide support to patient support groups, and also work in corporate organizations. So these are the diverse role of genetic counselors. Of course, mainly we do conduct genetic counseling and also provide education or training to future genetic counselors, and also training doctors and nurses on how to perform genetic counseling. Thirdly, some of us may be involved in advocacy role, especially to help patient support groups that are affected with genetic conditions. And the last component would be to participate in research and publications, help develop policy development, and also get involved in professional development activities. So this is a question I usually get as well on how to become a genetic counselor. So to become a genetic counselor, you first of all need to have a bachelor's degree, mainly in science, but some of the courses also do consider bachelor's degree in helping professions such as psychology, social work, nursing, or public health. So after your first degree, then you would decide to pursue a master's degree or postgraduate degree, which usually takes 2 years to complete. So in our region, we do have master's programs in Taiwan, Japan, Indonesia, Philippines, and Malaysia. So after you have graduated from the program, it depends on where you wish to work and practice, then you will then obtain a board certification from the respective countries. So this is a paper that was published in 2019 that explains the global state of genetic counseling profession. So as you can see, in the Asian region, there are more than 350 genetic counselors that was identified in 2017. So as we all know, genetic counseling profession began in the US almost 50 years ago, and it has grown internationally in the past 3 decades in Asia. But of course, in some countries which are still developing, there are still limited resources to provide genetic counseling. And as recommended by the Royal College of Physicians in the UK, it's recommended that there should be at least 6 to 12 genetic counselors per million population. However, internationally, only a handful of countries can come close to achieving this. Let's zoom into Asia. So Asia is basically the largest continent in the world based on land area and also population that comprises of 4.67 billion people. It can be subdivided to 6 regions that consist of 48 countries, mainly North Asia, South Asia, Southeast Asia, East Asia, Western Asia, and Central Asia. So because of this diversity, the region of Asia is actually filled with different ethnic groups, different culture, religion, and of course, different socio-economic, healthcare, and government systems. And needless to say, the development of genetic counseling profession also differ. So this is a table that summarizes the genetic counseling profession in East Asia. So I just wish to highlight that Japan, China, Taiwan, they do have a very well-developed genetic counseling profession, as they do have certified genetic counselors with training programs and also certification pathway that are certified by their professional societies. So as you can see from this table, at the moment it's recorded that Japan has the most genetic counselors, which are 289 genetic counselors that are board certified. And they also have the most genetic counseling courses, which started since 2003, and they currently have about 23 courses in place. As for China, it is undefined in terms of the number of genetic counselors, but in the recent paper in 2019, it was indicated that there were at least 52 genetic counselors in practice just in Shanghai alone. And we are also not very sure if they still have a master's program that is in place. But it is reported in the recent paper that they do have local training programs and certification pathway by the Chinese Board of Genetic Counseling. In Taiwan, they do have 14 genetic counselors and also 14 training programs, and their certification pathway is governed by the Taiwan Association of Genetic Counseling and also the Taiwan Human Genetic Society. As for Hong Kong, there are 6 genetic counselors that were trained. Most of them were graduates from the Australian program, and there are currently 2 postgraduate programs for genetic counseling. And recently, in a few years ago, they have also set up the Hong Kong Genetic Counseling Society. Well, there are limited information that I could obtain on South Korea, but based on the global state of genetic counseling profession paper, it was reported that there are 12 genetic counselors, but we're not sure whether they do still have a postgraduate course active. But it was indicated that they started training since 2006. Next will be the genetic counseling profession in South Asia. So at the moment, I have only information from India. So in India, they have set up the Board of Genetic Counseling India, which was established in 2014 by Dr. Annie Hassan, which is currently the president of BGCI. Their certification pathway started since 2015, and they currently have 213 certified genetic counselors. They also do have 4 training programs and certificate courses, as stated on the slides. So for South India, there is still limited information on other countries such as Pakistan, Sri Lanka, Bangladesh, Nepal, Bhutan, and the Maldives. So next comes Western Asia. So I could only find information on the Saudi Society of Medical Genetics. So it was indicated that they have about 20 genetic counselors, and there are 2 training programs, which is a postgraduate diploma that started in 2003, and there are 2 master's programs in genetic counseling since 2015. They also have a professional registration board for genetic counselors, and there are limited information for other countries in Western Asia. So let's move to Southeast Asia. So this slide just shows the development of clinical genetics training in Southeast Asia. And I wish to highlight this because it is due to the clinical genetics training that has helped advocate the need for genetic counselors. So since the last 30 years, clinical genetics services has been progressively developing in Southeast Asia. And most of the clinical geneticists were trained abroad before returning back to their home country. And that's when they start advocating the need for genetic counselors. So I would just like to share the summary of the status of genetic counseling profession in Southeast Asia. So these are the 6 countries that were listed. So let's start with Malaysia, where I come from. So in Malaysia, we have currently 9 trained genetic counselors. And there is 1 master's course that started since 2015. And we do have the professional society, which is the Genetic Counseling Society of Malaysia. In Indonesia, there are less than 10 genetic counselors. And there is a training program which started since 2006. And recently, they have also set up the Indonesia Society of Genetic Counselors. In Philippines, to date, they have 15 genetic counselors that graduated from their local program that started since 2011. And they have also recently formed the Philippine Society of Genetic Counselors. In Singapore, there are 12 trained genetic counselors, and most of them were trained overseas. As for Thailand, Vietnam, and Myanmar, they do not have a formally trained genetic counselor, but they are training nurses and doctors in genetic counseling in their local program. And there are limited information on other countries such as Cambodia, Laos, and Brunei. So I'd just like to highlight this paper that was published in 2013 after the pre-conference workshop for Asia Pacific Conference of Human Genetics in 2012. So in this paper, we just like to highlight that in Southeast Asia, we do have impacting factors for conducting genetic counseling, as the 3 main factors are the language, the religion, and also the cultural aspects. So I'd just like to highlight that because of the need for training local genetic counselors in the region and the factors that affects the decision-making of the clients. This is why we need to train local genetic counselors to meet the cultural and language needs of the population. So next comes the professional issues of genetic counselors in Malaysia. So basically, I have highlighted this 4 main issues because I believe that the other neighboring countries in Southeast Asia also share the same issues. So firstly is the shortage of genetic counselors. So most of the genetic counselors in the last 20 years were mainly trained in Australia, in United Kingdom, and only of late trained in Malaysia. So as I've explained earlier, the recommended number of genetic counselors per million population is at least 6 to 12. And there is definitely not enough genetic counselors in individual countries. Secondly, there is also no post in the public service in Malaysia, as it is still not yet a formally recognized profession. So there is by default a limited career pathway for genetic counselors practicing in Malaysia and also in certain countries in Southeast Asia. So at the moment in Malaysia, general counselors are actually registered and licensed with the Malaysian Board of Counselors under the Counselors Act in 1996. However, we do know that genetic counselors' role is different compared to a general counselor that deals with other psychosocial and family issues. So thirdly, there is limited training programs for genetic counseling in Malaysia. So even though we have established a training program in 2015, it is still not enough to train more genetic counselors to meet the demand. And lastly, professional recognition is still not yet established even after 18 years. So we are working hard trying to convince the government to create a post for genetic counselors in public service. And also in our professional society, we are also working on a credentialing pathway. So next comes professional societies in the region. So we have the Asia Pacific Society of Human Genetics that was formed in 2006. So this society primarily consists of clinical geneticists that are practicing in the region. And every 2 years or 2 to 3 years, they would actually organize the Asia Pacific Conference of Human Genetics. So it is through the APSHG that we have proposed to set up a special interest group known as the Professional Society of Genetic Counselors in Asia. So we have submitted our proposal before 2015 with the vision of advancing and mainstreaming genetic counseling profession in Asia so that we have equitable access to quality genetic counseling service. Our mission is to empower genetic counselors to develop and lead in the provision of genetic counseling services in our region. So our aims are basically, firstly, to foster partnership among Asian countries because 20 years ago, there were not many of us that are in practice or have been trained. So secondly, is to facilitate professional development and to provide continuing education opportunities. Thirdly, to participate in policy development. Fourth, to promote genetic counseling research. And lastly, to expand access and delivery of quality genetic counseling service in our region. So this is our progress since 2015. That's when PSGCA was formally launched in Hanoi, Vietnam, during the pre-conference workshop in the 11th APCHG. So as you can see, it was a very overwhelming event because we have so many genetic counselors from various countries in our region gathered together in the same room. So the first out of this conference, that's where we had the opportunity to learn about the ongoings of genetic counseling services in individual countries through their country report presentation. And from this workshop, we were able to publish our first joint paper, which is a report of 10 Asia Pacific countries describing their current status and future directions of the genetic counseling profession in the Journal of Genetic Counseling in 2017. And then following that year, in November 2017, we were also gathered again in the 12th APCHG in Bangkok, Thailand, where we also organized a second pre-conference genetic counseling workshop. And following that, 2 years later, we last met in Manila, whereby we had the third pre-conference genetic counseling workshop at the 13 APCHG in Manila. And following that, the pandemic occurred, but despite the limited opportunities to meet again, we have started with organizing the first webinar in May 2020, which was presented by Dr. Silva Man on telegenetics. And followed by in July, we also had our first collaboration with the Board of Genetic Counselling India in their conference. We have provided some speakers from PSGCA and APSHG to contribute our knowledge and to the event. And in November 2020, we also started engaging with the different genetic counselors from different countries to promote GC Awareness Day. Then following that, in December, we organized a second webinar on peer supervision in genetic counseling. And recently in February 2021, we also organized a third webinar by an invited speaker, Dr. Emily from the US, entitled Genetic Education for Health Professionals. So towards the end of this talk, I would share on the development of genetic counseling profession in 3 different countries, in Malaysia, Indonesia, and also in Philippines. So let's start with Malaysia first. So on the left side shows the progress of genetic counseling services in Malaysia which was started since 1994. And the first genetic counselor was in practice in 2004. And in total, we have 9 genetic counselors, 5 of which were trained overseas and 4 were locally trained. So in Malaysia, it used to be just both of us, so myself and Ms. Yoon. We both graduated from the Australian program, and we have both obtained our certification with the HGSA. So in 2015, we have set up the Masters of Medical Science in Genetic Counseling program in the National University of Malaysia. And in 2018, we have gathered enough genetic counselors, and also with the support of clinical geneticists, we have formed the professional society, which is the Genetic Counselling Society of Malaysia. So this slide just to show that there are practice guidelines recognized by the Ministry of Health Malaysia to provide a practice guideline for genetic counseling that includes advocating for genetic counseling by genetic counselors as well. So what we are still struggling with is basically the credentialing pathway to supervise practicing genetic counselors in the country. And also hoping to achieve the to find a solution to the professional issues that we are facing at the moment. So we have drafted the practice guidelines and also proposed to the Ministry of Health division in charge of the Allied Health Professions Act to include genetic counselors as part of the Allied Health Act in Malaysia. So I'd just like to highlight in this slide the different professional development activities that has been conducted in Malaysia. So next comes professional development activities in Philippines. So again, just to highlight, there are currently 15 genetic counselors in Philippines, and they have also established a master's program in 2011. And recently, they have set up the Philippine Society of Genetic Counselors. So this next slide shows the professional development activities in Indonesia. So the Indonesian Professional Society started with the INASA-IGE, which is Indonesia Society of Human Genetics. And only recently in September, they have also set up the Indonesian Society of Genetic Counselors. And both societies were founded by Professor Sutana, which is a clinical geneticist in Indonesia. Their master's program started since 2006, and it was established in Diponegoro University in Semarang, Indonesia. So the interesting thing about Indonesia is most of the genetic counseling services were provided by clinical geneticists, and only about less than 10 are actually non-medically trained genetic counselors. So this next slide summarizes our future directions, especially in the Southeast Asian region or in developing countries. So first of all, we do need professional recognition. So genetic counselors has been around for about 20 years in our region, but we're still not getting enough recognition by the government and also other healthcare professionals to highlight the need for genetic counseling. Secondly is to create an official job position with the title genetic counselors. So in the past, genetic counselors do not have a position in public service, speaking for in Malaysia. And because of that, we are conducting genetic counseling, but under a different job title, such as medical social worker or a scientific officer, or even just a generic counselor title. So having an official job position will really help develop the profession as we move on. Thirdly is to set up a certification pathway whereby we have local board of genetic counselors to certify practicing genetic counselors in the country, and also to regulate the profession. And lastly is to increase or set up local postgraduate courses to train more genetic counselors to meet the demand. Thank you for your attention.
Greetings, everyone. It is my pleasure to be here at the third edition of the World Congress of Genetic Counselling, and on behalf of the European Board of Medical Genetics, as its past president and as a member of the Genetic Nurses and Counselors professional branch. I'm a genetic counselor, and I was trained in Cuba, where the training and practice of genetic counselors has the highest priority. I have been practicing in Portugal for 20 years now, where I have promoted genetic counseling education and research, as well as the recognition of our profession. I work at the National Center, that is a National Reference Center for Predictive Testing of Neurological Late Onset Disorders. It integrates a genetics laboratory in a research institute with a strong academic link to the University of Porto. But this brief talk begins by acknowledging the effort of a group of professionals who, led by Professor Heather Skipton, made possible the establishment of an European registration system for genetic nurses and genetic counselors as a huge advance for the genetic counseling profession in Europe. I still remember the emotion of that day at the ESG conference, where Heather announced the beginning of our European registration process. The founder members of the genetic nurse professional and genetic counselor professional branch, and some of the current ones, have been based in countries where our profession is not yet recognized, and all of them offer their services on an entirely voluntary basis. So it is with great honor I'm here representing them and all of the work they have been promoting. As we know, the evolution of the genetic counseling profession began at the 70s, after the beginning of the first training programs in the USA, and later in Canada, Australia, and Cuba. In fact, the history in Europe started later with the foundation of the program in Manchester by one of the Sarah College graduates, the Professor Laureen Kersin-Storer. After this, the first genetic counselors start being employed in Europe, and since then, the roles and tasks of this non-medical healthcare professionals group at Genetic Services have evolved very fast. Particularly, the process of developing an European registration system began in 2006, where members of the Education Committee of the European Society of Human Genetics and the Imaging Test Project undertook an extensive literature review focusing on the current state of health professional training for dealing with genetics, and this resulted in a document where core competencies in genetics for healthcare professionals in Europe were defined, and which include the competencies required specifically for genetic counselors' education. The educational pathways and training for genetic counselors in Europe were very heterogeneous at that moment, and most of the countries had not developed standards for education or practice, neither regulation or professional certification of competencies. Some countries had specific programs in genetic counseling with significant differences among them regarding the contents, the duration, the amount of clinical placement, but most of the European countries had not. An informal network of genetic counselors and nurses from 23 European countries was initiated. Later on in 2009, the ESG set up an ad hoc committee for genetic nurses and counselors for support the work of ensuring adequate standards and of practice for genetic counselors and initiate the accreditation of this professional group. This ad hoc committee assessed the courses offered in Europe at that time and decided that those at Cardiff and Manchester in UK, Marseille in France, Barcelona in Spain, Portugal and Cluj in Romania fully complied with the European core curriculum for genetic counselors education. In 2012, the ad hoc committee became part of the new European Board of Medical Genetics as one of its professional branches. The goal of this new organization was to establish professional standards for education, training, and practice in human and medical genetics and in genetic counseling. And since then, the core activity of the European Board has been to develop and promote academic and professional standards necessary to provide competent genetic counseling services in Europe. So the Genetic Nurses and Counselors Division focus on designing a process for registration of genetic counselors practicing in Europe. This includes defining many procedures and concepts, such as the different routes for access, using approved master programs or national routes or grandfather clauses, and the evidence required for each of them. By including access to counseling supervision as a core evidence for the EMBG registration, I believe we have been also promoting the evolution of the genetic counseling profession, because as we know, it is essential to be aware of when our own personal issues are influencing our work with patients and to explore our responses to patients, for example, involving transfer or counter-transfer processes. And it has been completely new for many colleagues and line managers and supervisors at genetics departments how to differentiate clinical supervision from counseling supervision and how to manage the emotional load associated with empathic work and to explore how we can improve our practice. Also, we know that because of this requirement, some associations of genetic counselors in Spain and France and more recently in Portugal has started seeking models for counseling supervision of their professionals. All these processes have been published and is available in the website of the European Board. As right from the beginning, we perceived that significant proportion of our applicants came from a country where there was an established registration system from the UK, but also we received applications from the USA and Canada, and recognizing that international movement of genetic counselors and the need for countries without training programs to import this kind of professional, from outside, we defined a proper route for genetic counselors coming from a background where a national program exists. So at this time, the branch started reviewing national genetic counseling certification or registration systems outside Europe, and where a rigorous national system of registration exists. Practitioners who were already fully registered with them and work in Europe for at least 1 year were able to apply with us without an additional assessment. In correspondence, the Genetic Counselor Professional Branch approved international agreements with 5 certification boards. Approved boards are operating in the United Kingdom, USA, Canada, South Africa, and Australia. And of course, we are aware of the difference in who credentials, national or state governments, the professional bodies involved in this process, the differences in the goal of credentialing, and how applicants demonstrate entry and professional level of competences, differences in how they apply, how they are named, if they use or they need to do a written or an oral exam or portfolio, or how CPD is defined. But we believe this step was very important in promoting the genetic counseling profession, not only in Europe, but internationally. A very important meeting was organized by the ENBG in 2016. Over 75 colleagues from 20 countries were participating in Barcelona at the Transnational Alliance of Genetic Counselors meeting, where we were discussing genetic counselors education, certification, and workforce issues throughout the world. The day after, the ENBG organized a closed meeting with all the international committees representative from Australia, Canada, France, South Africa, United Kingdom, United States, and we were discussing the relevance of truly reciprocity among certification systems, how important was to exchange professionals around the world for promoting new roles and competencies for training new professionals of genetic counseling in many countries. We were also discussing specific actions for promoting the genetic counseling profession outside Europe. The ENBG was launching at this meeting the associate registration as an offer to formally review genetic counseling master courses outside Europe that would like to be approved by the ENBG. We decided to take this step for 2 reasons. Formal approval of genetic counseling master programs is not available in many countries, and we had feedback from some coordinators of new master programs outside Europe that a formal review by an established organization would be helpful, accrediting their program as at the level of the European standards, and how this can help them in developing the profession in their own countries. We have also some requests from genetic counselors working outside Europe who felt that they would benefit from a recognition of their competencies at the level of the European standards. We have also received particular requests from national societies of genetic counselors to support them and endorse local actions for regulation of our profession. And of course, we have been very supportive to all of them. More recently, based on the development of the genetic counselors' role in genomics area, the Genetic Nurses and Counselors branch recognized how this led to new training needs for healthcare professionals working in clinical genetic services. So all master programs accredited by ENBG were invited to introduce genomics and bioinformatics into their curriculum. This decision implies new core competences and standards, and some of the aspects of the master accreditation were modified, as you can see in our website. Up to date, graduated students for those master programs are eligible for ENBG registration, and given the high quality of applications and the number of applicants from a wide range of countries, we strongly believe that the European registration system has brought real value to the profession of genetic counselors and nurses in Europe, and could be an example for other professionals as well. Till now, we have registered 111 genetic nurses and counselors from 17 European countries, the majority as genetic counselors, about 80 still registered with us, maintain the registration of today. They are already some European countries where genetic counselors are part of health services, working mainly within specialist clinical genetics services, but also in other specialties to support patients in cancer services, cardiology, metabolic clinics, obstetrics, and other settings. We know clinical genetics services have progressed significantly over the last few decades, and it's no longer possible to medically train clinical geneticists to meet the demand for the information and psychosocial support aspects of genetic services, in addition to the diagnostic aspects. So we have looked at the experience of those applying for registration, their motives for registering with us, and the perceived impact of the registration of their on their professional careers, and we found that clearly an important contribution of the European Board registration system is the fact that the vast majority of European countries don't have any national system or guidelines advising the training and practice standards for genetic counselors. Therefore, the European registration have had a key role in development of the genetic counseling services and adoption of best practice and training models. For example, in an open question regarding motivations for registering, we found that 30% of participants applied because they considered the registration would be relevant for their career development and as a kind of recognition of their work value and competence. Others registered to obtain an international certification and because of the absence of a registration system in their own countries. 30% of professionals registered to support the process and to collaborate in the development of the genetic counseling profession, and some respondents consider registration would be valuable to seek other opportunities in another European country. As to professional status, participants felt that registration gave them credibility among colleagues and enhanced their professional visibility. Some of the participants valued the registration process as an educational activity on its own right by reflecting on their own practice and continue professional activities. The majority preferred they had already felt an impact on their clinical practice and on their career development, and some felt that the European acknowledgement of the profession would support them to seek more recognition at the national level. For example, one of the genetic counselors who registered with us report that he had used the European registration to start a dialogue with their government for promoting the genetic counseling profession in this country. The general feeling was of momentum. The process would be recommended to gain a critical mass to give the tools to defend our profession as recognized professionals in genetics healthcare settings. When we asked the relevance of the registration system to improving the standards of genetic counseling practice in Europe, about 80% of participants felt that the registration system was very important to improving standards, and we can see a lot of recent publications illustrating the needs and challenge of patients, family members, professionals working in healthcare systems where genetic counseling services are not yet developed, such as Romania, German-speaking countries, Sweden, as well as the opportunities that integrating genetic counseling to the community would represent. Thus, a clear call for the integration of genetic counseling in the mainstream care for patients. Unfortunately, there are not yet many European countries where the needs of patients for the support provided by genetic counselors have not yet been recognized. the European Board continue its works to ensure that these patients' needs are appropriately addressed and not seen as any less important than the technical aspects of genetics or genomic testing. The new genomic investigations have great potential to achieve additional diagnosis and effective therapeutic guidance, especially for cancer, for example. However, we believe that all these have led to a huge amount of information and a greater need for careful and informed discussions between patients and professionals, which genetic counselors have the time and skills to address. So the European Board of Medical Genetics proposed that genetic counselors are a vital resource in responding to all these challenges. We are moving to our 10th anniversary, and our main goal is still the same: to serve the needs of patients of genetic services in Europe through ensuring good standards of practice of the three professional core groups represented at the European Board: the clinical laboratory geneticists, CLGs, the genetic nurses and counselors, and the medical genetics and genomics. During the last year, we were fostering the European recognition of the professions of our three groups through a joint action of the three branches that result in a position statement, which is currently being submitted for the endorsement of the main umbrella associations of our specialties, the European Society of Human Genetics, the Public and Professional Policy Committee, and we also plan to reach the coordination of the National Society of Human Genetics. We believe the European registration of genetic counselors in particular have resulted into more autonomous practice opportunities and recognition of genetic counselor competences. All the rigorous work of professional registration and the definition of training and professional qualification standards are key factors in promoting the quality of practice and ensuring patient safety at clinical and diagnostic activities in the European genetics healthcare services. In a young but quickly evolving field such as genetic counseling, professional registration have been especially relevant. What else can be done? I believe that it would be relevant to conduct more cost-effectiveness studies to provide significant evidence on the added value of genetic counselors at healthcare services, evidence on the amount of consultation we perform, effects of access to information and higher literacy. There is a lack of truly reciprocal agreements to allow the circulation and international recognition of the genetic counselors, and therefore international credentialing boards have pending issues to work with in promoting the genetic counseling profession worldwide. But also there is a need for international collaborative work to understand which factors have stimulated the growth of the profession in countries such as Cuba, USA, Canada, and to look at them to improve our work in Europe. National societies of human genetics can have a greater role in promoting national legislation and recognition of genetic counselors. And I think we need a greater union of professionals groups linked to genetics, not from an elitist vision, but focus on the greater benefit of genetic patients and their needs. Because if the needs of genetic patients are at the center of healthcare authorities and policymakers, it will be impossible to not realize how urgent is the recognition of our profession. Many thanks to you all for your attention.
Hello, everyone. So it's a great pleasure for me to be presenting on genetic counselors, legal recognition, and the road less traveled, but giving it to you from a Canadian perspective. I am an assistant professor at the Faculty of Medicine and Health Sciences at McGill University. I would like to acknowledge the contribution of Dimitri Petrinos, who's an academic associate at our center, and my colleagues from the Gen Council project, led by Alison Elliott here in Canada. And this is a Genome Canada funded project and CHR as well. So I will start by talking very quickly about legal recognition internationally, and then talking about what's going on in Canada, looking at different legal recognition models in Canada, and discuss practical considerations for each. This has been a topic that has been of great interest of mine for many, many years. And I think with the expansion and evolution of the profession itself, a lot of questions arise in terms of ensuring the consistency within the profession, but also the protection of the public as well. And I will end with a few next steps that we are thinking about here in Canada through our Gen Counsel project. So what is legal recognition? And I think it's a very important point to discuss, because as I was first looking at this topic many, many years ago, I think there was a confusion in terms of what was the goal of legal recognition. A lot of professionals, a lot of genetic counselors thought that this was a way to limit their work. But at the same time, we forget the real purpose of legal recognition. And this is really a process of regulating professions that pose risk of harm to the public, not by their own, but if unregulated. Right? We can think of, for example, the role of a lawyer. We don't want anyone to be giving legal opinions. The role of a physician, we don't want anyone providing what they consider as care if they're not well trained. We don't want anyone giving any nursing, nursing in any way, shape, or form, and providing treatments or whatever if they're not well trained. And so the idea here is to ensure that we have a profession that is consistent, is coherent, has its own disciplinary systems, and would not pose a risk of harm because anyone who's practicing it is regulated and is qualified. And this is, I'm mainly looking at it here from a Canadian perspective, but this is mainly a legislative process that goes through laws and regulations. And the main role, as I was mentioning, is to protect the public. In Canada, our country is a federal country that has a federal government, but also provinces and territories. And our Constitution divides powers, legislative powers, between these two sort of levels. And the regulation of professions is something that is done at the provincial or territorial jurisdiction. And this means that every province could have a very different process or a different system. We cannot have a national legislative process when it comes to regulating professions. From an international perspective, and I won't be telling you anything new by saying that there is a rapid expansion of the profession at a global level. There are more and more students that are trained in genetic counseling, which is a great thing. And we also see some form of legal recognition in countries around the world, as per more recent publications. Examples of this is the United States, France, South Africa. In the United States, it's a licensure process, right? So it's a right of privilege to engage in practice of genetic counseling. In France, it's also the same process. It's a licensure, the creation of a profession through legislation, and it's through the Code de la Santé Publique. There has been some changes more recently, which increased a little bit the autonomy of the genetic counselors. In South Africa, it's a registration process within the Health Professions Council of South Africa and through their Medical and Dental Professions Board. These are examples from an international perspective. So if we look at it from a Canadian perspective, we clearly will note that there is no legal recognition in most of the territories or provinces except in Manitoba, which uses a delegation model. And I will come to that in a few moments. But we do have what we call a certification system that's provided through the Canadian Board of Genetic Counselors. However, this is different from legal recognition, right? So A certification does not make it a legal requirement to practice genetic counseling, and some Canadian genetic counselors practice based on American board certification. What happens if we don't have legal recognition? So the status quo pretty much means that anyone may practice genetic counseling or present themselves as genetic counselors. That could potentially create public harm if incompetent or inadequate provision of services is given. There's also no continuous oversight by mandatory professional disciplinary measures or professional inspection. And the idea here is legal recognition will bring us to a safer, high-quality genetic counseling where only qualified practitioners will be able to work. And why is it so important? Well, as I was mentioning at the beginning, genetic counseling is an expanding, field. There's an expansion of scope of practice. There is increased autonomy. Genetic counselors don't only work in human genetics departments in hospitals, but they're now involved in research. They're involved in private practice as well. And there are a number of different acts that genetic counselors do, which, if an unqualified person performs them, there could be harm, including risk assessment, ordering genetic tests, interpretation of genetic test results, psychosocial counseling, and so on. So we've looked at the legislative landscape in Canada and tried to look at the different models that exist. So the first one is the constitution of a professional order. The second one is the inclusion in an already existing professional order. And the last one is a delegation model. So the constitution of a professional order means that we have to create a regulatory body. It could be an order or a college. The idea here is that there's a delegation of regulatory powers by the state to this professional order, which will be tasked with looking at educational and admissions requirements, practice-based and ethical standards, public accountability mechanisms like formal complaints and disciplinary procedures. And this brings with it what we call title protection and reserved or controlled acts. In other words, nobody could present themselves as genetic counselors if they're not part of the order, and nobody would be able to do reserved acts for genetic counselors if they are not part of the order. Advantages of this model, well, it's highest degree of public protection. There is legal professional status that is given to genetic counselors. There's a high level of autonomy. There's increased public and visibility and credibility. And the disadvantages here are it's the model that presents most challenges in its implementation, very lengthy to achieve, and requires sufficient human and financial resources. There's the second model, which is the inclusion in a professional order that already exists, right? So we can think about genetic counselors being included in that order if there is sufficient connection between them and the other professionals in the already existing order. We're talking here about the same scope of practice, similar professional activities, similar requirement for education or training. One of the provinces that we're currently looking at for this approach is British Columbia, where we're working on reducing the number of health professions colleges from 25 to 6, which means that they're probably going to be bundling a number of different professions together. It could be a potential option for genetic counselors in British Columbia. Advantages, well, once again, it's a high degree of public protection and allows a smaller occupational group like genetic counselors to be included because of the lack of financial or human resources, if that's the case. Disadvantages, well, you don't have regulatory autonomy because you are part of an already existing order and it will not be unique to this profession, which also does not provide the genetic counselors with a unique professional identity. And the last model is the delegation model, right? So the delegation of reserved acts by professionals, which means that you have a professional, in this case, it will probably be the physician, and the physician will have reserved or controlled acts. This means that they alone are able to do them, and the law allows them to delegate some of those reserved acts to other professionals. And this is the case in Manitoba, where there's a delegation of communicating a diagnosis related to a genetic disease or disorder from the physicians to genetic counselors who are certified by either the Canadian board or the American board. And this is something that needs to be in the law, and it's in the College of Physicians and Surgeons of Manitoba, a general regulation. Advantages: it's probably one of the most straightforward to establish compared to the two other ones. It's less resource intensive. There's a potential for smaller occupational groups to benefit from it, but there are a number of disadvantages. There's a lot of control that's kept on the delegating professional. There is no legal professional status, and when it comes to public protection, it's probably one of the ones that have the lowest amount of public protection here, because it's only limited to the performance of certain acts, not all acts. There are practical considerations, of course, and we mentioned the issue of resources many times. There are financial resources. We have to look also at the human resources, the number of genetic counselors. This is an approximate number. It's not an exact one. We have approximately 484 genetic counselors in Canada. 89% of them are in 4 provinces, so British Columbia, Alberta, Ontario, and Quebec, which begs the question whether or not, this will have an impact on the model that is going to be chosen. And there's also other practical considerations which will help legal recognition, where they can also play a very key role. It's the professional associations that already exist. So in some provinces, we do have provincial associations of genetic counselors. These are not legal entities, but they are profession or associations that work with their professionals within the territory and help establish range of practices. They have a lobbying power, and we have 5 provinces that have such associations. The one from British Columbia and from the Yukon Territory are joint. Otherwise, there's Alberta, there's Ontario, there's Quebec that have professional associations. One of the things that we are working on right now is trying to come up with a sort of a Canadian consensus, or at least deliberation towards a consensus on legal recognition. What we want to create is a pan-Canadian working group where we want to share information and experiences between provinces and territories, working on finding agreements on core set of elements, whether it's scope of practice or arguments, for legal recognition. We want to discuss the different practical factors that will come into play, and we want to work on a national campaign to raise awareness and support. For those of you who are interested in reading a little bit more about our work, there has been 2 publications in the past year and a half. The first, this is the second one actually, that came out more recently in June of 2021 from the Journal of Genetic Counselling. It's led by Deborah Lambert and is part of the Gen Counsel study, where we talk more about practical issues. This one was published in the McGill Journal of Law and Health, and this is a more legal discussion, approximately 54 pages long, but for those of you who are interested in looking at some of the legal aspects, you're very welcome. And we do have in there a lot of discussion and comparison with international approaches to legal recognition. So thank you very much for your time. I would like to thank our funders and the Gen Counsel project, of course, and the institutions that are part of our project. And we'll be very happy to listen to your questions. And those of you who are interested in contacting me, here's the Twitter handle for those of you who have Twitter. Or you can contact me at man.zawati@mcgill.ca if you would like to share your own experience from an international perspective. I think that will be very valuable. Thank you very much for taking the time to listen to this presentation.
My name is Jan Hodgson. I'd just like to thank the organising committee for this invitation to talk about genetic counselling education during COVID-19. The Master of Genetic Counselling at the University of Melbourne is a 2-year full-time program. In the Southern Hemisphere, we teach between March and November, and some of our subjects that Master of Genetic Counselling students do are shared with those in our other program, the Master of Genomics and Health. Our program's accredited by the Human Genetics Society of Australasia, which means that graduates can be employed as entry-level genetic counsellors. Our enrolment numbers are limited by the amount of clinical placements available, so entry to the program is very competitive. So the Melbourne experience, and some pictures here of our beautiful Melbourne campus. We're celebrating 25 years of genetic counselling training in Melbourne, and we've graduated over 300 genetic counselling students. Our graduates are working all over the world and across Australia. And we teach our program face-to-face on the Melbourne Children's Campus, where we've got beautiful world-class teaching facilities, a research institute, the Murdoch Children's Research Institute, and Clinical Genetics Services, Victorian Clinical Genetics Services. And our identity has always been closely aligned to this campus, and we have easy access to renowned researchers, clinicians, and scientists, many of whom teach into both of our programs. I won't spend too long on this, but the Human Genetics Society have competency standards for genetic counsellors, and that's how we design all of our curricula. So basically we teach towards counselling skills, reflective practice, critical thinking skills, case management skills, and professional and ethical practice. In first year, our students do principles of counselling subjects and a year-long introduction to genetic counselling subject. As well, they do clinic observations and a community placement with a genetic support group. In second year, they undertake 48 days of clinical placement alongside genetic counselling practice tutorials, and these really consolidate their learning and provide supervision experience. So pre-COVID, students used to undertake 3 different types of 16-day placements. So COVID arrived in March 2020 in Australia, and we're talking here about the impact of COVID on our programs in a country where we've had relatively low case numbers overall. But we're really mindful that for many of our global colleagues is still experiencing devastation and great sadness associated with the pandemic, and we're sending our very best wishes to all of you. So in March 2020, Melbourne went from one of the most livable cities in the world, and there's our beautiful Hosier Lane with all the lovely urban art. And it went to the most locked down city in the world. We've experienced in Melbourne 262 days in lockdown that's only recently ended. And what this meant for our students was that for our 2019 intake, they had 27 out of 48 teaching weeks face-to-face. For the 2020 intake, we managed 3 teaching weeks before we went to remote teaching. And for our 2021 intake, so far they've had no face-to-face teaching. Clinical placements were suspended for many weeks, and some have only recently resumed remotely. We're hopeful that we'll be back in our teaching areas in March 2022, fingers crossed. So I'm just going to talk through how we evolved over this time. And obviously we needed a rapid conversion from a face-to-face teaching program to online education. And we were fortunate that we met with the HGSA Board of Censors, who brainstormed with us alternative ways of getting our students sufficient clinical experience so that they would be fit to practice on graduation. And part of this was allowing students who were working as intake assistants to incorporate that work experience into placement days and logbook entries. Overall, our placements became 2 lots of 24 days, which meant that students all spent longer at each service. And we utilised actors and practicing genetic counsellors for simulated client activities. These were videotaped and watched in supervision groups, and students did some written reflections. The Board of Censors generously gave CPD points to the practicing genetic counsellors who were our simulated clients. We did lots of additional role play activities, including assessments, and students have always had their own role play club. So we tried to increase the amount of time that we spent on that. And we developed a virtual clinic, and my colleague Melody Menzies is going to walk us through how that happened.
Thank you, Jan. So the virtual clinic that we did, the purpose of it was to replicate a genetics clinic, and students were assigned 2 to 3 clients and were given a referral and a genetic test report for each client. What they needed to do was perform an intake call for each client via telephone, and they presented the cases in pre-clinic meetings that were run by certified genetic counsellors and clinical genetics fellows as supervisors. They also saw the clients on Zoom for a consultation, and this was done unsupervised and recorded, and they did do the whole consult. And they attended supervision post-clinic, but we also watched these consults in our supervision groups, and the students reflected on them as well. Our simulated clients were our first-year Master of Genetic Counselling and our first and second-year Master of Genomics and Health students, but we also had a variety of colleagues as well who participated. And anyone that was a simulated client was given actor briefing notes, which included a family history and any relevant information that they needed to know. So these notes were actually quite specific. It actually said, this is what we want you to disclose in the intake call. This is what we want you to disclose in the appointment. So the students felt that that gave them a realistic experience. And for the students that attended as clients, they were also offered a debriefing session afterwards and a supervision session. So they all attended that afterwards to consolidate their learning. We asked our students to describe in one word their experience of the virtual clinic, and these are some of the words they used. So exciting, real, helpful, realistic, affirming, satisfied, promising. We thought these were really encouraging terms because we're worried that they might say stressful or anxiety provoking, but they all felt it was a really positive experience for them. In terms of the feedback, we have asked the students for feedback anonymously and collected that feedback to evaluate this program. And here are just some of the quotes. So I found going from start to finish of an entire appointment independently was very helpful. It helped me in thinking about how to prepare for appointments, how I would lay everything out, and then allowed me to reflect. And many said this type of quote where because of COVID, they had limited opportunity, and it really allowed them to conduct a full session from start to finish. And for many, it was the first time they had really done that. So the clinic was rated very highly. Here's some additional feedback. A good way to show the skills that I've learned, no pressure on us at all, which allowed us to be authentic. And this is what we really stressed. You know, there was very limited risk because these clients weren't real clients. And so it meant that the students could try something that they might have not otherwise tried. And we encouraged them to do that and push that envelope. In terms of educators, the lessons that we learned was that it's possible to achieve good learning outcomes when usual face-to-face delivery was not possible. So we were able to teach online effectively. We know that telehealth is here to stay in terms of our clinical services in post-COVID Australia. It wasn't something that was done often before, but it is something now in a country that's as big as ours and as as diverse and spread out as Australia, it's something that will stay in clinical services. So something that we now need to teach our students and give them more skills in telehealth during the program. So on that end, we are going to continue our 2 24-day placements. We found that these 2 longer placements were better for students and supervisors and gave students significantly more depth than the 3 shorter placements in second year. We're also going to do more Zoom and actor simulations and continue to encourage role play club with the students. The virtual clinic was a big hit with the students. They all felt it was really useful. So we will continue to do that even post-COVID. And we will include more online lectures. So we acknowledge that face-to-face is our identity and a strength of our program. But some of our lectures may lend to being online, and we will try to do this as well as face-to-face delivery. We were pleasingly able to ensure that all of our students were fit to practice on graduation. So our 2020 graduates all had sufficient clinical hours despite many months of lockdown and no placements. And they also had sufficient logbook cases. 90% of that cohort are employed in a genetic counselling role, which is no different to previous cohorts. And our current second year cohort are due, the ones that only had 3 weeks face-to-face are due to graduate in December 2021. And again, we have no concerns about all of them, and they've got to the finish line and are a very high standard. I would just like to acknowledge our students, our faculty, our colleagues at UTS, and also the Board of Censors. Thank you.
So thank you very much, all the speakers of session 1, which was a very interesting session. Now we have time for some question and answers, and we have the speakers with us in this call. And I have a few questions in the chat that I will hope to get answered from the speakers. But first, I have a question to Chris. I think the movie was lovely, and I think many people from different areas of the world got some kind of faith in how to develop the role of genetic counselors in their country. So just to start, Chris, if you would give the people, the pioneers in different areas of the world, 3 points how to succeed with this journey, what would you give them?
Work together, and that means working together internationally. Our registration system, we scoured the Australian registration system, we looked at the American registration system, we actually stole from nursing as well. So 30 years ago, we were trying to work internationally. So it's work together. You just have to be really persistent because it's not straightforward and it's really hard work, and there'll be setbacks along the way. And the third thing is really understand what you want to do. So, what is it about setting up competencies for safe practice, and that's the end of it? Or is it actually setting up a regulated health profession, which requires changing laws or understanding legal frameworks and is about protecting the public?
Thank you. So we have one more question for you about the career development for genetic counselors in UK. After you have developed this educational system, is there a clear career progression pathway for the clinical roles and remuneration to match that in UK today?
Yes, there is. And actually, it's almost by chance in a way, in that. So the group at Guy's, because of the issues about nurses and the science graduates being on different pay scales, which is obviously not a great thing to have in a team, some people being paid more than others and lack of transparency. They had already put together a sort of joint career description, but coincidentally at the same time, the whole of the NHS reorganised its pay scales. So because the work had already been done, we were able to just slot in there. Again, it was a lot of work by individuals going to meetings, negotiating. So most genetic counsellors in the UK are currently in clinical practice, are currently employed by the NHS. So they're on NHS pay scales, and there's clear advancement. We have things like consultant genetic counsellor roles, there's managers roles, there's an expectation of the pay scale that would be associated with that, benchmarked against other professions. And having that has allowed a transfer of that career structure and suggested pay scales into other roles outside of the NHS, for example, the private sector, clinical services, research roles, policy roles, and such like. So it was a combination of having thought about it and done some preparatory work, and then coincidence about a system-wide change that was happening at the same time that we were able to slot into.
Thank you. We also have a lot of questions about the registration systems in the different areas, and we have a few questions for Juliana from the people in Malaysia, certainly, then, and also in other countries. Now they're taking the course in Malaysia, how is their future going to be? Will they get a certification process to take, or is that even possible when the institution is not even recognized or accredited yet?
Right, so I've noted the questions. So basically the university course is accredited by the local boards. Obviously you need to get some accreditation before offering a master's course. But in specific to, let's say they are trained in a local course, the Genetic Counselling Society is still working with the Ministry of Health, working with the Allied Health Professionals Act, and internally to come up with a certification pathway for the local graduates, and not just the local graduates, but also the genetic counselors practicing in Malaysia itself. So we may have, before we set up the course, myself, Miss Yoon, Tiara, Rifan, we were 4 genetic counselors that were trained in Australia. So 2 of us have obtained the HGSA certification for genetic counseling, and the other 2, they are undergoing the certification. And we have Miss Azwin, who is leading the course in the National University of Malaysia. She was trained in Cardiff. So the syllabus that are taught in Malaysia are almost like reference from our programs that we've underwent, right? So we are doing a lot of work as well, trying to work with the government to come out with positions in public health. Even when I was in practice, there was no position for genetic counselors, and that was like 2004, right? So we have come a long way throughout the last 17 years, and we are quite excited that we finally see some light as of yesterday. So the Minister of Health, he just announced the need for genetic counseling in public service, and also they have been very supportive as well. And through the professional society, we have also contributed a lot of information and background to them. So there is a lot of opportunity still, so not to be too bleak about it. So, yeah.
Thank you. And we also have a question of if there are like any boards of genetic certification for genetic counselors in the world for people from other parts of the world, with other master programs, for example, or even other pathways than master programs. So I think I will give that question to Milena to discuss that a little bit.
Thanks, Charlotta. Yes, I think another option for Malaysia master course is to apply with us as an associate in order to obtain an associate registration, because the first step is to assess the master programs according to the standards we have been defined and promote at the European level. And then it is not the registration with the EMBG, but it is a process of certifying you are training and practicing according to the European standards. So perhaps it's another step you can perform. We have been having opening this route of access for master programs outside Europe for a while. We didn't receive any application, but at the moment when we launched it, it was really because we felt that need. Some particular professionals contact us saying they need to provide they are practicing in a competent way according to European standards, and also other master directors contact the European board. But additionally, Julian, we have been also sending letters of support endorsing the promotion of our profession, even in Europe, but we can do the same outside Europe, because what we want is our international recognition, not only in specific countries or continents, but and in that sense, you can send the contract to us, to European board, and then we can send you a letter saying what this kind of recognition is very relevant for patients' safety and for the quality of our practice. This is the goal of any registration system. So I think at least with us, you can count and we can help you in that way.
Thank you so much. I'll definitely contact you after this.
Thank you. I also have a few questions for Man, who is not part of this question and answer session. He will, though, be part of the spatial chat in the networking session tonight at 10 to 9 British Summer Time. But to have a little bit of a discussion of his talk, I would like to ask, we have the three different ways here. It's development of the profession, it's registration process, certification process, and it's legislation. And just for the whole speaker board here now to discuss a little bit about the difference, what could be national, what could be international, what can we learn from each other, and what is very specific to the specific context you're in. If you want to discuss that a little bit, open to everyone.
Shall I get, you've never known me not to put my hand up, Carlotta, which has been a great mistake all my professional life. I would say learn to say no, everybody. That's the first lesson you need. I think if we go to legislation, if I go to that end point, I think considering routes to legislation was only possible after developing the standards for practice and the competency for practice and the understanding what a genetic counsellor is. And that's where I think we all have to work together personally. But in terms of legislation, that depends on which country you're in and which legislative authorities you have. And I suppose where we are in the UK, in fact, is a mixture of MAN's models 1 and 2, in that the original Genetic Counsellor Registration Board is called a Quality Assured Voluntary Register. So it does have a quality assurance stamp by government. And the expectation is that people calling themselves genetic counsellors working in the NHS will be registered with this Quality Assured Registration Board. So it's a professional register in its own right. And then we have this new route of entry where people coming out of it will be his Model 2, which is registered under Healthcare Professions Council as clinical scientists. So clinical scientist, genomic counselling branch. But we've worked very closely. They're not two, the competencies are the same, you know, the standards are the same. The GCRB worked very closely to ensure that things weren't diverging. Legislation is important because it means that if you're unfit to practice, you can be struck off. And then there are legal sanctions if you practice not being registered. And I think that's really important to protect the public. There was a question further on about legal liability. In the UK, I can't talk to other countries. In the UK, of course, physicians hold their own legal liability, so pay for insurance for legal liability. All other healthcare workers are covered by their institutions. So if I work in a hospital seeing patients and somebody makes a claim about the hospital related to my practice, it's the hospital pays the cost of that claim. But if I went out and worked as an independent private practitioner, I would need to hold my own liability insurance. And I would argue very strongly that the things that we do in our practice is really important, and we can harm people if we don't practice safely. So that's my 5 penneth.
Yes, I think the focus should be, we have a common goal of promoting this safety practice and do not harm patients. And that I know we have a lot of particularities according to the legal and organization of services in each country, and a lot of difference. But if we focus on what we have in common, I think a good start point would be at least to have truly reciprocal agreements internationally among the registration systems that are in place. Because if we promote that the registration system in Europe is the same or is having the same goal, comparing with the USA registration system, the Canadian one, and all this, I truly believe we will be helping the steps at the particular countries that has anything in place regarding registration or legal, because all these international registration systems and actions are lights for the countries who are just starting, because they can use those examples as relevant for promoting the evolution and the development of our profession. It has been what happened in Spain, in France, in Portugal. We have been having the models of UK, the models of other of the European registration system for promoting, for saying, hello, this is important for professionals who are practicing in genetic counseling. This is the experience in other countries and has worked well. So I think this is another important thing we need to promote, to have these international agreements and international joint actions for helping in promoting the practice of genetic counselors, even having a lot of disparities and difference and cultural aspects that we need to take into consideration. But I think it's another action.
Thank you. So we talk about having the international agreement and same visions about the recognition of the counselors, but we are in different contexts, we have different cultures, different legislation. But one thing we have in common in this world, the last years anyway, are the COVID situation. And we got some question about your talk, Jan, about the education in a COVID world. And now I'm just going to find the question here. So you said it was quite successful with a virtual education system, and the genetic counselors came out with the same amount of skills and also employments. Do you think that you will continue? Do you think it's a successful way of continuing with this hybrid model of GC training? And also, if you could tell us a little bit more about the challenges that came up with that. Thank you.
Yeah, thank you. So I think there's definitely a place to take quite a few of the learnings that we had during that period and incorporate them into our program. We have always enjoyed being on the Melbourne Children's Campus. It means that our students have access to so many events that happen across the campus, which has research and clinical services, and we're based in a children's hospital. So I suppose we wouldn't want to lose that, but there's definitely elements of the teaching that we've undertaken remotely that we can incorporate. And I think it's particularly important now when many of our students need to work a significant amount of time while they're studying. So we do need to make our programs perhaps more accessible for people to be able to do that. For example, at the moment in our program, you have to do first year full time. So we're starting to think about whether we should relax that a little bit and maybe think about offering different modules, and perhaps some of those could happen online. Yeah. I guess in terms of the challenges, apart from the obvious ones of getting us all up to speed with the technology involved with teaching remotely, it was a lot about keeping morale high, because it was very difficult in Melbourne. Even though we didn't have so many cases, we had a curfew, we were all locked down, everywhere was closed. So a lot of our students lost their casual work and lost their income. So it was really about trying to see how we could support them and also support our clinical services. Many of the counsellors come in and teach on our program, and they also offer placements. And we were very mindful that we didn't want to overburden them with asking for students to be on their telehealth consults all the time, for example. So, yeah.
So did things be even better with the virtual education? Were there any things that really worked even better than online, on-site education?
I think apart from the flexibility of being able to not have to physically go on campus, I think that many of us are looking forward to returning to our face-to-face. And as I say, we will incorporate some elements. But it was good for us to recognise that our students didn't miss out on so much. They missed out socially, but they did have Zoom catch-ups. And we tried to make sure that during our online tutorials, which were all held synchronously, so students had to attend at the time of the tutorial, but we tried to put them into breakout rooms during coffee breaks and try to really give them some time to get, as a group, to get together.
Thank you. So we have a few minutes left. I got more like a comment to I suppose it's Chris, because it's UK anyway, saying that it's from other countries that are developing now and are in their start to develop genetic counselors. And you have been there since 2003 about, you were there. So would it be possible for you, from your UK journey, to share documents and regulatory material to ease up the process in other countries?
Yeah, absolutely. And the European Board of Medical Genetics as well, nursing branches, Genetic Counselling and Nursing Branch has lots of materials available on the website. The sort of contacts for the UK model is the Association of Genetic Nurses and Counsellors and the Genetic Counsellor Registration Board. And other countries. And as I said, right back at the very beginning in the 1980s, we were looking at the Australian materials and the South African materials and the American and Canadian materials. So absolutely, we should, but I'm sure each registration board that has been set up is willing to share their materials and experience.
So with that, I thank you for this question and answer session, and hope to see you in the next session. That will be at 1 o'clock British time. Please go to the spatial chat area to discuss with each other now afterwards and ask questions. And you can also ask questions to Man in that area. So please, let's meet there very soon. Thank you.